Good morning, everyone. Thanks to those who are able to join. We're going to give people just a few minutes to get logged in here, and then we'll kick this off. Good morning. If you're just joining us, I'm Simone Turek-Lee, and we are going to get started on this webinar in just a moment. We're going to give people just another minute or two to join. All right, we've got about 50 people on. I'm going to go ahead and get us started, and then if additional people join, then they can jump in at that point. So good morning, welcome, happy Wednesday. Thanks for joining. I'm Simone Turek-Lee. I'm the Director of Housing and Health with John Burton Advocates for Youth, and we are going to spend the next hour talking about some developments with the THP NMD and THP Plus participant tracking systems. And why don't we start by I'd like to go over a quick agenda, and then I'd like to introduce someone who's joined me today to talk through these options with everyone. So welcome and introductions. We're doing that right now. We'll talk about sort of the timeline, kind of over the next few months, over the next several months, what this will look like in terms of this transition of the tracking systems. We'll talk about options that all of you have that are currently using the system. And then we'll talk about the process for exporting and saving your data, which is really important. And we'll talk about the process for those who are interested for transitioning the tracking system or systems to your own platform and hosting it and continuing to use it. And then we'll have a question and answer session at the end. Please feel free kind of throughout our call here to enter questions into the box and hit send. We'd love to collect them throughout, and we may even be able to address some of them during the presentation portion if they feel really relevant, and we're getting them a lot. So please go ahead and enter them throughout. There's no stupid question. We have our database expert on here who I have a lot of technical questions where sometimes I think this is a really stupid question, but there is no stupid question. So feel free to ask away, and we'll ask it. So again, I'm Simone Turek-Lee. I'm the Director of Housing and Health with John Burton Advocates for Youth, and I'm joined by Josh Senyak. Josh has a consulting business, Quicksilver Consulting. We've been working with Josh for over 15 years at this point. He built these tracking systems, he maintains these tracking systems, and he's an extremely wonderful, generous partner to work with. And I think all of you will grow to love him as well. So why don't we just start by, I think everyone on the call knows this already because this is why you're here, but I want to make sure we're all starting off on the same page. Sent out this information via email a few times over the course of the last couple months, but after several years, we have decided here at JBay to stop hosting the participant tracking systems. It was a hard decision to just kind of be transparent and let everyone in. This was the decision that we sort of thought about for actually many years, and we love these systems, and we think there's great importance, and we feel really proud and thankful for all of the data they've been able to provide and the basis for policy advancements that the data has been able to contribute to. But we have chosen to end our management of this system. And I just want to, because I think this is a question that people have, is just explain a little bit of rationale as to why we've made this decision. These systems were really important. Well, I'll say this, the THP Plus system was really important. We launched it back in 2007 to make the case for why youth need extended support beyond age 18. This was before extended foster care. THP Plus was sort of the only thing going for young people after they turned 18 in terms of housing support. And so the data from this system that showed that education and employment outcomes, improve when you support young people beyond age 18, and homelessness decreases, and all of these kind of positive outcomes, it was really key in making the case for extended foster care and other investments. We were also able to more recently make the case to have additional funding for transitional housing. So we recognize the importance of these systems. It's why we launched them. It's why we launched the THP NMD one in 2014. But we're really, excited that we have the research from the Cal Youth Study. We now have the TAY Hub, and the data that HCD is gathering from all of you from the Transitional Housing Program funding. There's more data now, and so we are encouraged by that, and we're hoping to see continued efforts to collect data regarding this population to continue to make the case. But I think we are in a different place now than we were many years ago, and so we have decided, as a very small organization, we never have more than like 10 people working here across the state. It is best for us, like the best use of our capacity, to pull away from sort of managing databases and put that capacity towards some of the other things that we work on. But we really didn't want to just lose the system altogether if people were interested in continuing to use it. And so I think that's where today comes in how you can continue to use the system if you so choose. So what's in front of you is the timeline. We are going to make this transition by May 1st. So we have about, at this point, what is that, 3 months to do what we're going to talk about in this webinar. So we notified people in December, beginning of December. Today we're having this webinar, and then we're hoping that a month from now, by the end of February, that you all can make a decision on how you want to proceed, whether you want to stop using the system and grab your data that you already have all that, but stop using the system, or if you wanted to continue using the system within your own organization. So that we will send around a survey to gather that information from you next month, or you can also just email and let us know if you do want to continue. Either way works. So, and we'll talk about that a little bit later. By the end of March, we'd hope to have sort of transition contracts executed for any organizations or counties that want to continue to use the system. There is some basic information that we do need to kind of tie up loose ends in a contract. And then by the end of April, we hope that those transitions for those who want to keep the system would be complete. And by May 1st, we would deactivate the statewide version of this that we manage and sort of step down from management. Someone's asking if the PowerPoint can be recorded and shared. Yes, or the PowerPoint and recording can be shared. Yes, it will. We will send that out today to everyone who registered for this webinar. So that is coming to you soon. So again, your current options are pretty simple. It's a fork in the road, two ways to go here. One is you can stop using the system. That's fine. We know many organizations have additional databases that they're capturing data in, or other ways that they manage their participant data, and maybe feel that this was sort of an extra thing they were doing and are going to stop doing it, and that's fine. Of course, the other way to proceed is you want to keep using the system. Maybe this is the main way that you gather data and maintain data on the young people in your program, and you want to keep doing it. It has all your data already. You don't want to transfer it and kind of have to do something new. So you want to keep using the system. That works too. And so there are these two options. You do need to make a decision, like I said, over the next month. And first we want to just and I want to also sorry, I forgot to say one thing on the last slide, that throughput that kind of goes through the whole arrow there. Current users export all of their data and save. This is something that does need to happen before that May 1st date. So that I want to just say, I'm going to say this a few times throughout the presentation, just because I know we need to all hear things a few times. This is important. We want to make sure that you do this. We want to make sure that you have all those years of data that you've worked so hard to enter. So please do that, and we'll actually demo for you how to do that if you are struggling with that component later. So, well, actually, right now I'm going to show you. So that's why it came up very quickly. So I'm going to first, I'll just say that, like I just said, regardless of whether you continue with the system or not, all current users should export and download their data by April 30th, 2024. So we do have a kind of a how-to one-pager on that, so you can do it on your own. It is not hard to do, but I know that things are always easier when you sort of have a step-by-step instructions. So that is something that you can do on your own. I'm currently going to copy and paste this link into the chat so that everyone, I don't think you can pull it off the PowerPoint. So putting that into the chat. So that's the one pager on how to do it. And right now, I'll just take a few minutes and demo for people how to do this. So I'm going to stop sharing my screen for a second. I'm going to log into the tracking system. So I'll do it on the THP Plus tracking system. I'm logging in using a provider login that is a fake provider. So I can't remember what it's called. I think we called it, what is it called? Test Agency 1. So this is not real data. You're not going to see any sensitive data here. Just want to clarify that. I'm going to reshare my screen. Too many things open here. Okay. Here we go. Right. Okay. Now, Josh, can you tell me, can you see the tracking system screen? Great. Okay. So I'm here, I'm in as a provider. You can also do this if you're a county user. You go to the same place, you go to reports. So I've logged in. I'm going to go to reports. And you all know there's a series of reports available. You're going to go down to export full participant data. Okay. Gives you some options. Now you can see here, you could download data just on one participant. These are all pretend people. Or you can do it on everyone. Of course, you want to do it on everyone. If you're getting all of your data, you're going to enter a date range. Just to be safe, I'll just put a really old date, right? Because we want to make sure that we get it from the very beginning. So I've just put 2007. If I was doing this today, I could enter today's date, right? But ideally, again, this will happen. You want to do this after you're done entering data. So if you're going to keep entering data through next month, do this at the end of next month. Do this when you're done entering your data, when you're choosing to stop entering data. Now you can apply this to the entrance date, the exit date, or just active during. So just let's unpack this a little bit. So this entrance date, this is going to mean that you're going to get data on any young person who entered the program between January 1st, 2007 and January 31st, 2024. If you apply it to exit date, you're going to get data on any youth who exited during that date range. If you apply it to active during, you're going to get it for any young person that was in the program during these dates. So I'm just going to apply it to active during. You can do it any which way you want, depending on what you want from the system. Like if you only want data on youth who have fully gone through your program and exited, apply it to exit date. I'm looking for data on any young person who's ever been in my program. I don't want to limit it to participants who have been in the program for some portion of months if I want all of my data. Now, if you only wanted to see data on young people who had been in the program for, at least 6 months, like they had some dosage of your program, you could limit it that way. But I'm just looking for all my data, so I'm going to leave that blank. I don't want to just see data on youth who are custodial parents or youth who are not custodial parents. I want all the data, so I'm leaving it on either. And I'm going to show my identifiers. I actually want my full data. So I want to know what people's names are, their birthdays, their, everything that's in there. But if for some reason you wanted to share this data with a third party who you didn't want to identify youth's personal information to because they were going to do some analysis, you could not show the identifiers. Okay. But so I'm going to show identifiers. I'm going to run this report. So it just downloaded a zipped folder to me. And then when you open, I don't think you guys can see this on my screen, but when you open the zipped folder, I'll just sort of tell you, when you open the zipped folder, there's two documents. There's the entrance exit follow-up document and the quarterly document. And these are spreadsheets that you can open up and all of the data will be in there. And you can, open them in Excel or, other applications. And I've put this in the little one pager, a link to it, but there are code books that you can download for the THP NMD system and the THP Plus system where you're able to decode it. So it'll say like, for yes, it's 1, for 2, for no, it's 2. And that way, that's just an example. That way you can go in and say, okay, I know that, was the youth a custodial parent? I know all the ones or no's. Yes, Josh, am I saying something incorrect?
No, not at all. The one thing just wanted to add was that, and this is for the techies who might be here, if you prefer to have a SQL dump of your data, some of you will want that if you want to import your data into a SQL system. We can do that too. You wouldn't do that through this report system. You just ask us and we'll give that to you.
Thank you. Great point. And that is also captured on that one pager. We've updated it to have that information. And I see someone asking, where can you get the code manual? So on that one pager where I put the link to in the chat, there is a link to both code books. So you can get them from there. I'm going to share my PowerPoint screen again, and we can go back to the slides. Let me just check the chat and see if there's any other sort of immediate questions here that would be good to answer. So we talked about the code manual. So someone asked, will the reporting requirements still be the same as far as quarterly reports and annual reports with all the same data that has been asked of us? The PTS is very helpful in capturing that data. So we will get to that in a second when we talk a little bit about what this could look like for you if you move it to your organization. So we will get to that. Link to the doc again. Yes, absolutely. I will share that again, because I know if people just join, they can't see the earlier chat. So this is the link to the document of how to export and save your data, and it has the links to the code books in it. And if you have any trouble with this export, please reach out. Like this, we definitely want to support you in getting this data. And like Josh said, if you have someone that wants to do a more in-depth analysis and wants to get this in a different format, he's also available to help get that to you. So moving on. So for those who are thinking of continuing to use the participant tracking system, there's some information we want to share with you. And I imagine this will be an ongoing discussion or ongoing conversation beyond this hour today. But we wanted to start by just giving some basic information. Like when Josh and I first started talking about this, and he said, well, there's an opportunity, like people can keep using the system. It's not like it has to just die. It doesn't have to just go away. It can be a living thing for people who want to continue to use it. I said, okay, well, what would that look like, Josh? Like I couldn't wrap my head around how this would work. So he helped me to understand different scenarios of how this could look. And so I want to bring you guys on that same page of sort of where I was a couple months ago and where I am now. So we just made up some pretend names of organizations and counties here on the right, but there's sort of the way that I think I've come to look at it is there's sort of 3, and there's really more than 3 options, because I think, there's ways to modify this in a way that it can work for you. I'm sure with some limitations, but I think that there's probably not just 3 options, but what I think of are 3 sort of common options based on what I know of your organizations and how you guys work and how you currently use the system. I imagine that you'd probably fall into one of these three categories. So there's kind of the simplest version, which is you're a provider that has one program. Let's say you have one THP Plus program, for example, in Butte County, let's just say, or we'll use the example I have on here, Rainbow County. So your organization's name is Youth Forward. You have one THP Plus program in Rainbow County. This is Rainbow County's, or this is Youth Forward's only THP Plus program. It is in this one location. You would host the participant tracking system, on your web platform, or you could, as Josh has pointed out, you could go with a commercial host, I guess. But this would be the only entity that would be able to access their data, this Youth Forward. Like, this would not be any sort of connection to another program or to another county user. This is a program that would have their data, it would live at their organization, and you'd be able to edit and view that data. So that's kind of the simplest version of I think what we're talking about here. And then you have organizations with multiple program locations. So just, like programs like Aspiranet or Environmental Alternatives, right? Like, these are organizations that have program locations across several, parts of the state, regional. And these organizations right now, when they use the system, every program location is captured as a different program. But I know that one thing that these organizations have raised is, like, is there a way that we could have central control over all of our programs without having to run separate reports? Like, what would that look like? And so I think in this transition, there is a world where you could have that. So here's just again, an example. So Youth for the Future has THP NMD programs across 10 different counties. This organization, Youth for the Future, would host the PTS on their web platform. Each program location would be recognized in the system as a different program. You could choose to assign access levels if you want. So we have these levels right now, and you could choose to assign them within your organization. You could have an administrator access user, with full access, like that's what I have right now, right? And then you could have a provider user. You could name these different things, but this is what we have them named right now. Provider user who'd be able to edit the data, but only for their program. So for example, if Youth for the Future was in Alameda County and Contra Costa County, you'd have an Alameda County program that could edit and view their data, but they wouldn't be able to edit Contra Costa's data. And then the Contra Costa program would be able to edit their data. They wouldn't be able to edit Alameda's, but the kind of administrative user at Youth for the Future could view and edit all of the data. So there's different, and Josh can maybe touch on this later if people have more questions about this. There's different, user permissions that are assigned. So right now we have county users, we have provider users, and we have administrative users. So you could do something similar to that in a larger organization where you wanted to structure this with multiple programs. Similarly, counties could do this. So if a county wants to keep using this system and wants its providers to keep using this system, you could have each contracted provider, similar to what we have now, as a separate, provider or a separate program. So using Rainbow County as an example, let's say Rainbow County has 3 THP Plus providers. The county agency could host the tracking system. Their contracted providers would be recognized in the system as different programs, would only be able to edit and view their own data, but the county would be able to, view all of the data. So there's different ways this could look, but I'm sort of, again, kind of sharing what I think the common arrangements are currently for counties and organizations. And if you're interested in asking, like, well, could it be a little kind of like this, but a little different? Like, those are the types of conversations that you could have with Josh, and we'll talk in a little bit about how to have those conversations with him. But again, I think that there's some creative things that can happen here within some parameters, of course. So just some things to know. I want to remind you of a few things. So first, I want to remind everyone that the THP NMD participant tracking system and the THP Plus participant tracking system are 2 separate, distinct systems. They're very similar. They look very similar. They have, the same functions essentially. But I want to remind everyone that those are 2 different web-based databases. And if you continue, if you're interested in continuing to use them both, that would mean hosting 2 separate web databases. Another thing to know, so Josh developed these systems back in, the THP Plus system back in 2007, and then modeled the THP NMD system after the THP Plus system in 2014. And he owns these systems. He's the developer of them, he owns them, and he has provided a lifetime license to all of us to use these systems for free. So this is something that he's not making money off this, selling these systems to people, but he does own them. And so this means that the system can't be sold or transferred by us license holders. It can be modified, but it's similar to, and I didn't quite understand this at first. I said, Josh, explain this to me, give me an example. And he said, it's kind of like Microsoft or Adobe. You have a license to those programs, but you don't own them, and you can't kind of sell or transfer them. But you can use them. The difference is you pay for those licenses. So he's given everyone a lifetime license. He said, have free for all, use the system, but he is the owner of the system. So I just want to make that clear for those who are wondering about sort of the anything kind of proprietary about this. The third thing is the software will have to be, as you guess, have to be modified slightly for installation for your organization or agency. It can be further modified, like with appearance or functionality, like we talked about a little bit, by Josh or by any other web developer with appropriate skills and knowledge. So that's just something to know as you're thinking through these options. So I'm going to answer this one question here, and then let's move on to this slide, and I'm going to have Josh cover this sort of more technical information, and then we will go into some questions and answers, some additional questions and answers. I think people might have some, once they hear this, might have more questions. But so someone said, would it become an issue if the county wants to host the tracking system with the contracted providers, but the contracted providers also want to host the tracking system on their own? Interesting. I assume the county needs to have a conversation with each contracted provider to see what their plans are for the PTS. Okay. So first thing is, yes, I absolutely encourage, especially if you have, I'll say about 1 in 5 people on this call are from a county. So predominantly we are providers on this call. We are more rarely counties. There are some counties that require providers in their contract to use the system. There's some that just ask that they please use the system. And they collaborate in terms of the county uses it, the provider uses it. The county currently uses it to run reports and view data. The providers use it to both enter and view data and run reports. So that's a great collaboration. If you want to continue in that fashion, or if you want to start using it that way, I think that's great. I agree. Definitely have that conversation, and we're happy to help talk through that with you if that's helpful. Now to the question in terms of would it be an issue, I think and Josh, correct me if you think I'm not explaining this well, but I think how this would probably work best if the county is engaged is, I'd say there's a few ways to do it. If it's a group of providers, you could choose that one of those providers, if the county didn't want to host it, that one of those providers could host it, and then there could be just kind of like we have now, you'd be playing the role JV plays. And then you'd have a series of accounts set up for people from various, other providers in your county. And then the county could have an account set up that's like the view only data. The way that I would assume it might make sense is for the county to host it because of the role that they play. However, I know we were just talking about how, counties there's a lot more bureaucracy and liability challenges and just a lot of paperwork that has to happen on the county end to do things like this, as we all know, than nonprofits. So things take longer at the county level. They require often kind of more sizable contracts. Like it's just often a little more complex. So I could see a world where the county's like, I don't know if we want to, this might be simpler to have a provider host. That's totally a decision that you all could make amongst yourselves. But I think either route could work. Now, in terms of both of you hosting the system, I'm going to sort of pitch that to you, Josh, to answer, excuse me, if that's an option or if that
Sure.
would even make sense.
Yeah, and I think Simone, I think where you were going with this is quite right. That it probably wouldn't be the way you would go. There would be no reason to have both the county host it and the provider also host it. But it could be that the county would host it and the providers would have access to it through accounts or vice versa. I think that some of this will become clear as we talk a little bit in a moment about how it's set up currently and how it would change in the future.
Great. So I will turn it over to you to kind of talk through the information on this slide or share anything else that you've thought of as we're sort of talking about this
Okay.
that we haven't captured in the slide.
Okay, sure. Thanks, Simone. Hi, everybody. I wish I could see your faces. I can't. I don't know if people are sleeping or listening. We're looking forward to getting any questions you have because there's a lot of material here, and this really might impact how you do your day-to-day business. So we really want to answer these questions as best we can. Try to be clear going in, and we will really try and answer your questions well when we get to the Q&A. One thing I realized as Simone was speaking is um, people may not have known how this was originally set up. So let me just tell you one thing that I realized maybe not everybody knew. This is a really simple fact, but we might not have disseminated it. There is just one, well, two, THP Plus and the NMD. Uh, there were just these two systems, but let's just talk about one of them for the THP Plus for a moment, let's say. Everybody, all the counties, all the providers were in one big database. Everybody's system was in one place, which was hosted by a service that JBay used. So all of those were in one place, but it was set up so that you would only see the data that pertained to you. So when you log into the THP Plus system, for example, all you're seeing is your slice of the single system, which is THP Plus. You're just seeing if you're a county user, your county and its providers. If you're a provider, only those that pertain to your provider. So what we're talking about now in this great kind of breakup, like we broke up the AT&T back in the last century into these little baby bells. In a way, if there's a need for it, we can break up these two giant systems we have, the THP Plus and the THP NMD, into as many portions as people want. If nobody wanted to use this again, my understanding is we would not need to do anything further here. But I believe the reason we have so many people on this call is some people are thinking maybe we want to keep using this system, maybe we don't, maybe we want to change it. So let's talk a little bit about if you are considering it, what would it take in order to do it? So Simone has made this beautiful slide which can walk us through some of the main steps. These aren't necessarily in the exact order they have to be. It's good to have them separated out, but here are some things that you're going to need in order to take this on, whether you take it on as a county, whether you take it on as a single provider just for yourselves, or a single provider perhaps providing this for a consortium of other providers that you're related with. You need a web host, and that's just a service that you hire. It's just, it's like the landlord that holds your web hosting services, and that's just where you put the files and where people log into. Now, when you log into thpplus.org, which is where your THP Plus data lives, that's the domain name. That's not actually the host. The host is called something different, but you've set up a domain name and you would set up whatever domain name is appropriate for you. It could also be, as Simone pointed out, a subdomain of your existing web domain, or you could get a separate one, whatever you like. It would then it would live on this web host that you would hire, and that's where the data and the software would live. You can use a commercial provider if you have your own web host, which is probably on a commercial provider if you're an organization and you've got a public-facing website. So I'm the Compass Community Services in San Francisco County. It would be maybe ccs.org or something like that. It could be a subdomain off of that. That could be where you put the system, or you get a separate place for it. If you're interested in HIPAA compliant hosting, there are some commercial hosts that offer what they call HIPAA compliant hosting. And it's, as you probably know if you've worked with HIPAA, it's not just technical. It's very much, and actually the difficult parts have a lot to do, not with the technical aspects, but with the organizational aspects. And all the host can say is, we comply with the technical aspects in terms of the different security measures. We will sign a business associates agreement with you, basically saying, we know this is protected information. We're not going to have just anybody being able to look at it. So if you want that little extra level, it's anything from $100 to $300 a month, which is more expensive than most cheap commercial hosting, which is just $10 or $20 a month. That's hosting, that's domain name. If we want to get into the details, we can either talk about it in Q&A or we can talk individually about it. We'll need to make some minor modifications just to get it from the JBay site to your site. No big deal. That's easy enough to do. But most likely you're going to want to make some changes. For example, you'll probably want to, take off the JBay logo and put on your own logo. You may say, you know what, we never wanted to answer all those questions about housing status. So we wanted different options. Or, you know what, at our place, we have to kind of go into lots more detail about veteran status. So we wanted to put more questions in there, but you weren't able to do that because JBay had to serve the entire state. You might say, we want to do things in a different way. We want to ask different questions. We want the pages set up differently. We want different reports. Maybe with some much more advanced functions. Every time somebody puts in this kind of data, we want it to email somebody. So there's all kinds of things you can do with the system afterwards, but that, you have to hire somebody to do that. The minor modifications to get it from JBay to your site, most likely you'd want to use me for that. Although even there, we could just give you the code. And if you've got somebody in-house to do it, they can already do it. For those other modifications for functionality or data elements, you can have me do it and you can have somebody else do it. The code is as well documented as we could do given the budget that we had. So somebody who really knows their PHP and MySQL and JavaScript should be able to modify it for you if you've got in-house people to do that, or you want to hire somebody else who isn't me. It's yours to do that with. Whatever you do, you will want training and support components. People always, I think, shortchange training and support. They think of it as a technical project. They give it to the wireheads and just think that'll be all there is to it. And there's not. Human beings have to know how to use the training and how to use the system, which is where the training comes in. And there's a support thing. Sometimes something just didn't work. Was working before, and your host perhaps changed their software, and so it doesn't work the same way anymore, or you need a new feature, or you're not sure something's there, you're not sure if it was a problem or not. That's where the maintenance and support comes in. So be sure as you're thinking about taking this on that you realize there is an ongoing budget that you have to put in for training and support. Again, that can be me, that can be somebody else. It doesn't really matter, but do make sure you write that in. There's a question, if providers keep using it, who outside from our agency have access to our data entered? That's a great question. And the answer is you decide. That's completely up to you. You choose who your users are, what those different levels of permissions you want to grant them are. With the current JBay systems, we have different levels. So the administrators like myself and Simone can kind of look at everything because we need to be able to fix the system or investigate the system. Each individual county can only see certain kinds of data, and each individual service provider can only see certain kinds of data. So it would be up to you to define that. At the moment, it's, once we split this off and give it to you and you install it where you want it, JBay would no longer have access to it. If you decide to, take me off as a user, I would no longer have access to it. So it's really up to you.
One more thing just to add about that, I think a thing to think about is whether you'd want your county to have access or your counties. That would be, like Josh said, that would be a choice. So you could choose to have a system where you're like, I want this to be the way that our county we're able to share our information with our county. But if you wanted it to just be an internal system to your organization, that's a choice. So again, these are things that are things to consider. You could say, well, I'd rather just communicate data with our county by downloading a report and sending it to them versus like just kind of having them in the system. But it's really, I think, a local and an organizational choice in terms of how you want to make this meet your needs.
Um, um, Simone, somebody asked a question, and I just want to dig a little bit deeper into it. Just to confirm, is JBay going to require, I realize the county may have their requirements. Is JBay going to require anything from the county or service provider participants in terms of reporting from now on?
No, no. I mean, we'd love to see people continue to gather this information, whether in this system or in another system. We think data is important. But no, we would know, as you all know, we have no formal authority. Like, we can't require anyone to do anything. You guys have been great in that you've stepped up to the plate and said, we care about having statewide aggregate data on these young people and on this issue to make the case. And that's been fantastic. And then in some cases, counties have required it in their contract, but we do not have formal authority to require any providers or any counties to provide any data. We never did have that. And because we'd no longer be managing this database, we'd no longer be asking for that. What we may ask for would be our annual, we used to do an annual report, as you all know, where we gathered survey data from either counties or providers. We've started to sort of maybe do that every other year-ish. We're trying to do it on a more of an as-needed basis at this point. We would probably still be surveying people, and we'd hope that to get as much response as possible. But as you know, in our previous reports, we would both have that survey data and we'd look at this quantitative data from the system. So if we put those reports out in the future, they just won't include the data from the system anymore, because we will not have access to it and it won't be being used statewide. So if we do ask you for data, it will be via a survey. And as I've said, it's never been a requirement. It's been something that people have been great about providing, and in some cases that counties have required.
I'm done with this slide, Simone, if you want to
Okay,
move on. Yeah.
great. Okay, so I think I think this is our last slide. And then if we have people have different additional questions, we can go into those, or we can close early also and save a few minutes at the end of the hour if that's if we don't have additional questions. So let's kind of just talk about next steps. We've given you, I think we've sort of scratched the surface here, given you this is what it could look like. This is what your options are. This is the timeline. And now this is your time to go back, talk internally within your organization, talk to maybe your county, or if you're a county, talk to your provider or providers. If you have big plans and thoughts bubbling in your head about a consortium, talk to your regional or your partner providers and see. I mean, that's another option, as you guys band together and say, we want to keep using the system as a group. Someone's going to host it and we're going to all collaborate to use it. That's totally possible. So have the necessary conversations that you need and want to have. And then and make a decision about which way you want to go. Again, if you're waffling on this and you kind of just want to talk about what's like, well, I want it if it can be like this, that's a great time to talk with Josh about whether what you want is possible. And he can kind of help talk you through that option. So we need you to notify us about your decision, like I said, either via email, and you can email that information to our office manager, Loris, at loris@jbay.org by the end of February. Or you can respond if you do plan on keep using it. I mean, we can respond when we send around this survey. You don't need to email Loris if you don't plan on using it. We can capture that in the survey. But if like today or next week, like we definitely want to do this, and you want to just shoot her an email, that's great. We just need to know this by the end of February. Between now and the end of April, make sure you export your data. So if you're going to stop using the system, pick your end date that you're going to stop entering data. The end of the quarter, as you know, is the end of March. So you could stop it there. You could stop it today. It's really up to you. If you are going to continue using the system, you should still export all of your data. You want to do that before the transition. Just, we always want to play it safe. So everyone should export your data. If you are continuing to use, you can arrange an informational call with Josh. Josh has generously, so we had said, we'll just, Josh, why don't we pay you to have an introductory call with any interested organizations? And he said, I'll do it free of charge. I mean, this guy's really generous, okay? So don't take advantage of his generosity. Don't go over that hour. No. But so he's offered like a complimentary hour-long consultation with any of you, all of you, during the month of February or very early March. And the timeline we're saying is that because if you choose to do this, you want to get going to start that transfer so it happens by the deadline. So that's his email. I'm also going to paste it into the chats just so you have it today. But like I said, if you want to talk over, if you're like, well, I don't know what my decision is, I really need to ask questions and know whether what we want is possible. This is that is the consultation. It's sort of like anytime you're buying something, or I mean, you're not buying this, but anytime you're looking to take something on, you want to interrogate it, you want to get a better understanding of what you're going to get and make sure that it's in line with what you want. So those are good questions to ask Josh. So schedule that call with him. And then you're going to determine whether if you do decide to keep the system, you want to make a decision about whether you want to continue to work with Josh sort of beyond that transfer, or if you have your own person. And like Josh said, this person, and I have IT person, that's probably not the right term, actually. It's probably, like Josh said, you have to have specific expertise. Like I heard him say JavaScript. What is it? MySQL, Josh? Am I saying it right? Okay. There's some stuff in there that this person does need to know. So you got to make sure you're bringing in the right person. Doesn't have to be Josh. But I will say he knows these systems in and out. He's very reasonable and easy to work with. And, just like I said, he's great. So I 100% recommend him if you're going to be keeping the system. But we understand sometimes you already have existing people in-house and you don't want to duplicate those efforts. And we totally understand that as well. So make that decision. And if you decide to work with Josh, also you can talk, in your consultation with him, talk with him about what that looks like. We, for example, kind of had a certain number of hours that he just kind of assumed he'd be working to maintain the system with us every month. And so that was sort of the terms of our contract. And then if we went above and beyond that amount of hours, it would be additional charge. So there's different, you can keep people on retainer, you can pay them hourly. There's obviously different ways to structure contracts, but it would be best to talk with him about that and like what the needs might be for what you're looking for and how he can help meet those needs. And then lastly, anyone who's using the system would need to execute a contract to become, a licensed user and to outline the terms of your agreement if you continue to work with Josh to help maintain those systems. So someone asked a question. So would I be able to get the slide presentation? Absolutely. We will send this recording and the slide deck to people after this call. And then does Josh have a license agreement already written out for this? Josh, I will pitch that to you. And
It's
that
a
is from
great
a
question.
contracts
And you know
person.
what? We probably should have thought of that. And we didn't. So I think this is the point of your question. Is there already a template which people should just fill in? We haven't made that template. Basically, I don't even know if how many people, if any, want to continue with this. And so maybe this thing I should work on is making a template because it would be we could make a generic template which it's like this is the part that we know is true for everybody, and then there's some things which maybe add on or change. So thanks for mentioning that, and I'll actually think about trying to make a template. If you have more questions, if I did not answer your question, William, come back to us and let us know.
Thanks, Josh. And I know that if you're from a county, which I believe William is, if I recall correctly, we know that these like contracts take longer and they often can be longer. And so if you want to start those conversations, this is something you're leaning towards, you want to start those conversations now about contracts, I really do encourage you to, because I know that things take, there's several steps, particularly within a public agency that you have to go through. So great question. Anything else that people want to ask about sort of what's possible or what the process would look like? Confusion?
I want to. I just noticed there's another question that we haven't. I don't think we've addressed yet, which was
Oh,
Brandy Martin said, "Is there any cost other than hosting costs if we just take over the system?" Um, you, you know, Dollar costs, I guess not. I think dollar costs, you could just take over the system and, still have JBay's logo and have exactly the same feels, exactly the same functionality. Um, but there's time, and there's time for you to set it up and to test it, to get the user agreements, to set up your permissions. So there's a real time cost, and you can do that all at your end. You don't need me to do that. We can just hand over the data and the code to you, and you can install it, and there's no cost for that. But there's a time cost, and it's really worth thinking that through. And if you do want to think through, well, here's how we want to do it, here's the model we want to use. How much time do you think we're talking about? Give me a call and let's just have a conversation, and we'll try and think through together what that might be in your particular situation, because I think it's going to vary a lot from user to user.
And I think I was just reminding myself that that I think when you said our logo, I think what's on it is the THP Plus logo, which is ancient, as you guys might remember, THP Plus Statewide Implementation Project logo. And then I think our name is on it, like John Burton Advocates for Youth is written on it. But I think that's, so yeah, I think you'd probably want to change that. But if you, I mean, again, up to you. But I think those are the sort of the branding that's current on the system. And of course, like Josh outlined earlier, there's sort of like you pay a monthly, what is it, a hosting fee, right, Josh? I mean, there's things that you'd have to pay to maintain the system, just because it costs money to host something, right? Okay. Any other questions before we jump off? We have about 9 minutes, but we can always end early if there's no more questions. Just make sure I didn't miss anything here. I think those are all the questions. All right. Well, Josh, anything else you want to share before we jump off with folks?
I can't think of anything. I am realizing, and Simone, you and I will have to talk about this just in the conversations today, realizing it's a very short timeline. Where we're saying if we're asking people to execute agreements by the end of March, and we're talking about unplugging the JBay version at the end of April, that gives us the month of April. So I think that my only thought from this conversation is let's think some more about timeline and not wait. I guess the other thing too, if you think you would like to do this migration to your system, please let Simone know and let me know so we can get as much done front loaded as possible, because we don't have much time. It's going to be April before we know it.
Yeah, I think we sort of have these deadlines in as the kind of final dates, but they're definitely not, they're the deadlines, right? So I encourage you, if you want to use the system, email Loris, and I'll put her email in here as soon as possible. We will be sending something around to try to get a response from everyone, by that deadline. But yeah, don't hesitate to email her and let her know. And that way you can start the other processes like contract, talking with Josh, and the process. So you have Josh's email, you have Loris's, you have mine. I think that's all you need.
And I would definitely say, look, I've been working on this for so many years with JBay, with Simone and her predecessors and her predecessors' predecessors. This has been around for a long time. I really would like to see this continue to work for for the community. Um, there were 79 people at one point on this conversation. Having 79 hour-long conversations will be kind of difficult. So please consolidate if you can. But I'm really happy to talk with you about what your particular situation is, give you my best advice for what I would do if I were in your situation, and hopefully, give you good guidance so you can get this going if you want to in your own locale.
Thanks. And this is a great question. We didn't mention this, but which I should have mentioned this. Yes. So everyone on this call, I assume, has a contract with us to be using the system. We will send a letter or like, contract termination around to every entity that we are in agreement with, by the time that we deactivate, so that those loose ends are tied up. So thank you for raising that, Alexa. And we will send that around. The challenge is, I think we often get bounce backs. There's a lot of turnover. It sometimes is not reported. So if you are, I'll just say this, we will send it to the point of contact that we have. If you don't receive it and you're like, that's funny, and so, reach out to me, because there's a chance maybe it went to someone else at your agency. Um, I could see that happening. So definitely, if you don't see something come through, say by the end of March or something, reach out to me. All right, any other questions? All right, well, we'll go ahead and end this webinar, and looking forward to talking with people over the next couple months about their decisions. And thanks everyone for tuning in, and thank you for entering your data for all these years.
Thank you all. Good luck in your transition. Hope this all goes really smoothly for everybody.
Thank you.